And thank you so much for joining the conversation tonight on Family Matters. We had spoken with Dr. Rudi Eggers, the World Health Organization representative for Kenya, regarding this virus, why it's spreading very fast, and whether Africa and the world is ready, and what will it take to completely stop the spread of this virus. Once again, I welcome you, sir, to the show, and thank you again for making time for us. You had earlier on said that as at yesterday, the infections stand at about 34,000. Maybe now you can break it down for us on the number of deaths caused and which particular countries, if you could remember all of them, that have been affected outside China.
So the deaths yesterday stood at 728 deaths, but they seem to be increasing, so it's likely that by today it's over 800 already. There's only a single death outside China, and that's in the Philippines. So as I mentioned a minute ago, the other countries that are affected mostly are in Southeast Asia, Thailand, Singapore, Japan, those kind of countries. But there has been spread across the world. There have been cases in United Arab Emirates, in Europe, France and Germany and the UK, and then also in the United States. So far we don't have any confirmed cases in Africa at all, although there have been suspected cases that have been isolated. But as we sit now, there's not a confirmed case in Africa.
All right. The most important conversation that we will have tonight is on the spread, because you said 24 countries are already affected and it's already outside China. But let's get to know more about the coronavirus, where we all had news that there is an outbreak of a virus, coronavirus, in Wuhan city, and everybody was worried and asking, what is the origin of this virus? Where did it come from? When did this all start?
Well, in fact, there are quite a number of coronaviruses. There are about 7 human-to-human coronaviruses that we know of already. This is the 7th, actually, of this family of coronaviruses. And previously, there have been the SARS virus and the MERS virus. Those are the most prominent because they're also called outbreaks. But there have been other coronaviruses that actually spread from animals to humans. So coronavirus is actually one of those viruses that is most predominant in actually spreading from animals to humans. There are many more among animals, but only 7 that have spread to humans. This specific virus was, as I said, detected at the end of 2019. We are not quite certain yet how it was transmitted, which animal, exactly how the transmission took place. The fact of the matter is that the initial cases, all the initial cases, were somehow associated to the Wuhan seafood market. So all of the initial cases had some contact with that. So it seems quite evident that the initial infections took place there. But consequently, this virus, as coronavirus do, cause respiratory diseases. People start coughing, start sneezing, start having fever, and that in itself then spreads the virus to other people. And that's really how the whole thing got started. So by 1st of January 2020, the seafood market was actually closed, and environmental surveillance started, and disinfectants, etc. So that source of infection has actually been contained. Subsequent to that, really, the infection has been human to human, transmission from one person to another, and that's how it really has continued to spread.
Yeah, all right. Before we talk about the spread of this virus, let's talk about some of the symptoms. Once you have been infected with this virus, how long will the symptoms begin to show? And is it possible for you to spread this virus when maybe the infection is still at incubation period?
So the symptoms are actually quite similar to the flu, the regular cold that many of us get, and it's actually quite similar. People get fever, they start coughing, start sneezing, having runny nose. Some of them, not many, but maybe 30% will have joint pains and those kind of things. One feels bad. You feel as if you are sick. So it's actually quite similar to the flu. In about 14% of the cases, according to the Chinese information, they become more severe. So those move on to respiratory failure, distress when breathing, and then ultimately also death. And about 2%, according to the current figures, actually progress to death.
Yeah.
But those figures might still change. We're still very early in the disease. We don't know exactly how it is, but that is the current information. What we've started to understand, it takes between 1 and 12 days after infection to develop the symptoms. Most of the people that develop symptoms are around day 5 or day 6, so that's when most of them have the symptoms. Although there had been initial reports of transmission from people that did not show symptoms, that actually has been quite limited. It's actually quite rare in coronavirus. If you think about it, the transmission is by coughing and sneezing, and those are the symptoms. So those are the people really that start transmitting this virus. So we are still investigating the transmission from asymptomatic cases, but it seems quite rare. Also in the other coronaviruses, it actually has been quite rare. So mostly they are transmitted by symptomatic people.
Yeah, so there is no possibility that any person, or when the virus is at incubation period, then the possibility or the chances of transmitting, are you saying they are zero? You cannot transmit this virus when the symptoms have not started, begun to show?
I think we're still investigating that, so I can't make a categorical statement, but it seems that the transmission is actually focused very much on the symptomatic cases. Those that do not display symptoms as yet seem to be quite rare in the transmission.
Yeah. It's really people who've been or showing these symptoms, or there's about every day there are reported cases of deaths, especially in China. So maybe you can let us know, once the symptoms begin to express, how long will it take for this virus maybe to claim your life, before it claims your life?
Again, that is quite varied among different people.
Yeah.
It seems that the people that are dying from this virus are mostly in the older age group and have some pre-existing condition, lung disease, heavy smokers, diabetes, those kind of things. So from what we can gather of the current information, and remember we still have about 800 deaths that we can call on, it seems that people that are dying have got some other precondition. Further information is being collected, and in fact WHO is convening a meeting next week to actually look at this data in much more detail and also get information from other sources so that we can be much more specific and clear on the risks of dying.
Yeah, there are a number of cases that have been reported, the recovered cases from this coronavirus. Are you linking this to what you're saying, the people who are dying from this virus are the people who have pre-existing conditions, or what would you tell of the reported recovered cases?
Yes, so it seems that the recovered cases are mostly among those that had mild disease. There are some that have recovered from severe disease, but mostly are from mild disease. And I think that too is also under development, and we will see how that develops. I think at the moment there are more than 1,500 cases already considered cured, so they have actually overcome the disease with their own immune system.
Yeah, and do we have treatment for this particular virus? Do we have cure for it?
We do not.
Yeah.
So currently there's no treatment or vaccine for this virus. As I said, it's quite a new virus. We have not seen this at all before. So currently, whenever people are presenting themselves to hospitals or to health facilities to be treated, the treatment that we can offer is mainly the supportive treatment of respiratory diseases. So initially is, of course, maintaining the fluid status, making sure that the breathing is, the oxygen is saturated, etc. And if they do go into respiratory failure, to ventilate them, etc. So it's supportive treatment that we can offer at the moment.
Yeah. Let's emphasize on how deadly this virus is. You're saying that the people who've been who are dying from the virus are the ones mostly with the pre-existing conditions. There are also a number of people who have recovered from this. Generally, as the World Health Organization, how would you describe how deadly is coronavirus? Is it something that should scare the world? Because the other day you declared it a global public health emergency.
So in fact, the figures that we have at the moment indicate that approximately 2% of the confirmed cases die. That is actually concerning. It's a substantial amount, but there are other diseases that cause much more death. So for now, also because we are still learning, and it's quite likely that there are many more mild cases that actually will not develop a severe disease or turn out to die. Actually, we are hopeful that actually it might be not as serious as that. But for now, the figures say 2% of the confirmed cases are dying.
Yeah, maybe you can also explain to us what are some of the conditions that led to this particular virus to be declared as a global public health emergency by the World Health Organization. Is it because of the speed at which the infections are spreading? Is it because of the deaths that have been claimed so far? Or what exactly does it mean when the World Health Organization declares certain disease or condition a public health, global public health emergency?
So the mechanism that is agreed internationally is that countries, through the international health regulations, are required to report diseases that are of unknown origin. And this is what China did initially. And as the cases increase, the World Health Organization convenes a committee, an emergency committee of independent experts from across the world, actually, not only from WHO, but across the world. And this group of people review the evidence of the cases and then give recommendations to the WHO Director General on how to proceed. The initial committee decided actually that there was not sufficient evidence to actually call it a public health emergency of international concern. So the initial reaction by the Director General was to hold back with that statement. Subsequently, on 30 January, following the recommendations of this committee, it was then declared a public health emergency. Now that is determined by things like the severity of the disease, the rapidness of the spread, the fact that it transmits from human to human, and the ability to transmit. So what is the mode of transmission? All those things are taken into consideration in that recommendation. Ultimately, it is still in progress, and the Director General will reconvene this committee and will continue to re-evaluate this information as it proceeds. Also, in terms of the international spread, of course, at the moment we are very concerned about China, but as the Director General has indicated in the last declaration of this emergency, his concern at the moment is also the ability to spread to the rest of the world, especially to countries with weaker health systems, where it might be more difficult to actually contain the disease.
Mm-hmm. Let's talk about the WHO response to this particular disease. After declaring it a global public health emergency, there have been concerns, especially what the UN Secretary just said, that China seems to have been left on their own when it comes to fighting this disease. Maybe what is WHO doing to help especially nations that have been affected? And now that you're saying there is only one death that has been recorded outside China, but over 800, that is a lot. What are you doing? What should other nations be doing according to now the capacity of every nation that you know, capacity of every nation? What should other nations be doing to support China in the fight against this virus now that you're saying there is no known cure so far?
So firstly, I don't think it's correct to say that China was left alone.
Yeah.
So in fact, actually, there was quite a huge response, not only from WHO, but from other international partners. And actually, that has been acknowledged by the Chinese government. It's actually been a very collaborative relationship with the Chinese government. They have been much more transparent and much more open about the disease and the sharing of information, also sharing of the science of the virus, which has really helped WHO and the world to be able to respond very quickly to this. What is WHO's job? Well, really, the first thing is sharing of information, also sharing of the science of the virus, which has really helped WHO and the world to be able to respond very quickly to this. What is WHO's job? Well, really, the first thing is to make sure that the information is gathered and is shared as widely as possible. The purpose of the International Health Emergency Declaration is really to make all the countries aware of this impending possibility of an emergency. So WHO collects the information, shares it with countries, helps those countries that need help in preparing for this disease, keeps the public informed, like we're doing in this television interview, also convenes experts to make sure things like the laboratory diagnosis are are sound, that the clinical management of cases are sound. So those are the types of things that WHO is doing to actually respond to this. One of the big things I haven't mentioned is recently WHO has become much more involved in the supplies. So the supplies of protective gear, supplies of respirators, supplies of masks, etc., because there is a need to make sure that those people that really need these masks and protective gear, WHO has become much more involved in ensuring that this is allocated to the countries and to the people that need it most.
Mm-hmm. All right, and do we have countries that are prone or at a risk of having this, let's talk about the people or the nations at a risk of having the coronavirus spread to their lives. We talked about the age or the people actually who have pre-existing conditions, but there have been a lot of speculations on this virus that it will affect these nations because of their weather patterns. Maybe you can clarify on that. Do we have specific areas in the globe that are prone or at a risk of having this virus spread to, or is any person in this globe at a risk, or any nation at a risk of actually having the coronavirus spread to?
Well, the fact of the matter is that of the cases that we see at the moment, almost all, there are just a handful of cases that do not have a direct connection with China. So the biggest risk at the moment is the travel to China or having been in contact with a person that traveled to China. So it's actually incorrect to say that everybody is at equal risk. It is really people that are in contact with people that have traveled to China that are at greatest risks. So from that you can also deduce which countries are at greatest risk, namely those that have got direct links to China. In Africa, we've identified a number of countries, I think it's 13 countries, that have got greater risk of this link to China, and they are being supported specifically.
Is Kenya one of them?
Kenya is one of them, yes, indeed. So Kenya has direct flights from China, previously with Kenya Airways or South China Airways, and that of course puts Kenya at risk of importation. But there are several other countries in Africa, and for that reason these countries are specifically supported to be able to detect the cases that are coming forward and to be able to treat those cases. For WHO, what they are designing to do is to make sure that these countries of highest risk have the ability to treat at least 100 cases with the best equipment possible. So that's what we are preparing at the moment, to make sure that Kenya and the other countries are able to do that.
Yeah, and now that there is no cure for this virus, how can it be prevented? Do we have ways of preventing this virus from spreading further and claiming many lives, affecting many people than it's already affected?
Yes, there are ways to prevent this disease. It is a respiratory disease, so what we need to do is we need to interrupt the transmission of this. So things like personal hygiene, the washing of hands, because often when you are coughing or you're touching your face, your hands actually transmit the viruses that you have. Making sure that if you do feel ill, that you present yourself to a health facility to be tested. When coughing or sneezing, and this is really important, this is a thing that people should really learn, is to make sure that they cough and sneeze not into their hands, but into their elbow, because your hands, you will be touching things, you'll be touching people. So that's really important. Then also, because it's a zoonotic disease, it relates to animals, making sure that the food that we are eating is prepared in a safe way. The virus does not transmit through cooked food, so cooking food properly is a very well way of dealing with the transmission of the virus. But then also the handling of food, making sure that uncooked and cooked food isn't cross-contaminating each other. So these basic means are what people in the public really should know to prevent themselves getting this disease.
Yeah, and is it possible to coexist with someone who already has the virus while applying those precautions that you're saying, and you still remain safe? Because there are cases where a whole family has been affected by the virus only because one person got it from a different location.
So WHO has published guidelines on the home care of infected patients, but that's not the situation in Kenya at the moment. So the situation now is that we must make sure that if there are suspected cases coming into the country or even in the country, that these cases are isolated in a hospital, in an isolation facility, and Kenya has put together isolation facilities to treat these people, so that actually it's not necessary for family members to take care of them. Should it become necessary in the future because there are too many cases, then of course there will be means by protecting yourself, hand washing, covering the mouth, etc., to protect the carers of those people. But for now in Kenya, those that are suspecting of this disease should really present themselves to the health facility to be tested and confirmed.
All right. And there are nations so far that have evacuated their people from China to their respective countries. Maybe would you say this is one of the advisable ways of just ensuring your people are safe, or what to do? What's your comment on that for nations that have evacuated their citizens from China?
So WHO doesn't recommend any travel restrictions or indeed evacuations at this moment. We are aware that countries have been doing this, and it is up to the countries to make these decisions in their best interests. At the moment, it's probably wise for those people to remain in their homes in China and actually make sure that they don't get infected there. Should the country decide to evacuate those people, so should Kenya decide to evacuate Kenyans from China, that should be done with all the necessary precautions. And once they are in Kenya, of course, they need to be put into a facility, a quarantine, where they can be checked over an extended period to make sure that they are not symptomatic.
All right. And for people who are already in China and who have already done that, what are some of the necessary precautions that once you decide to evacuate your people from China, then you need to take 1, 2, 3 precautions to just ensure that it does not spread further, especially to your nation, the people that you brought back from China, that you just contain it and does not spread. And let's say the people happen not to have, or some have the virus. How do you contain it? Because that has been the main issue.
Well, I think, as I mentioned, basically those people that are returning, if people are evacuated from China, they should actually be put into a quarantine situation so that they can be observed over at least 14 days, so that you can make sure that if there are people that develop symptoms, that you immediately can treat them. There are other means of dealing with it, so some countries have chosen not to quarantine the returnees, but I think in the Kenyan case that probably would be wisest.
And you mentioned that it's a new virus, the coronavirus, but we've seen some of the, especially for the nations in Africa, where the cases have been reported, suspected cases have been reported. We have some of the samples being taken to, let's say, South Africa. Maybe you can talk about some of the test centers that we have either in Africa or even in the world. Which ones are we talking about? And when a nation feels, or people present themselves, let's say in Kenya with these symptoms, what are some, or how do we trust that these results actually are right or not?
So currently WHO has 10 reference laboratories across the world. 2 of these are actually in Africa, in South Africa, the National Institute of Communicable Disease, and the Institute Pasteur in Dakar, Senegal. So those are designated reference laboratories, but there are many other laboratories around the world, especially also in China. Of course, we got the initial test from China. That being said, WHO is working very hard to capacitate other countries to be able to test for this virus. So as we speak at the moment, we are busy distributing more than 250,000 test kits for countries to be able to test for this virus. So we anticipate that Kenya will also be able, in the near future, within a week or so, to be able to do the tests here in the local laboratories. This, of course, will make it much easier to confirm the cases that you are suspect.
Yeah.
But that is in process, and we're doing very much to try and get this out to the countries as quickly as possible.
All right.
Part of that is also the training of the technicians, but in fact the test that we are rolling out is actually quite a common test. It's being used for many other diseases, so the technique of testing is well known. The laboratories have to go through some verification procedures, and once they've done it, we are confident that their tests will be correct. Even then, the first samples that they test still afterwards get sent to reference laboratories to make 100% sure.
Yeah, and you said that WHO does not recommend any evacuation of citizens from China because of the isolation measures that you say could work to prevent the spread for this. But we also have seen, because you talked about nations that have a direct link with China then are at a risk of having it spread to them. The idea of stopping flights to and from China, have you also recommended that, or do we also have some preventive measures when flights are operating to and from China?
In fact, WHO does not recommend travel restrictions. So the Director General and the Emergency Committee have both not recommended travel restrictions. So individual countries have decided on their own to institute those travel restrictions, but that is not the recommendation from WHO. The reason is that it seems to require a lot of resources to actually put these restrictions in place, and ultimately you find that people will find a way to travel where they need to go. Even if it's not on a direct route, they might take another route. So in fact, we found in WHO and other emergencies that travel restrictions are actually counterproductive in this situation. So it's not recommended. That being said, countries, of course, can make their own decisions. They're sovereign in their decisions on how to handle this. Should a country decide to institute travel restrictions, they are required through the international health regulations to make that known to WHO within 48 hours and also give their reasoning to make sure that there's a scientific reasoning behind it.
Yeah, and you addressed one side on how you prevent yourself from getting the virus, but how about the person who's already infected with the virus, apart from isolation? Because I've seen people, especially in China, walk with masks on them. Is it one of your recommendations, or what you do tell that? You also talked, because I believe when you have a mask, you said you should not be interacting with your face. Of course, you'd use your hands to adjust the mask. Is it hygienic? Do you recommend use of masks?
So let's talk about Kenya again. So in Kenya, because there are not many cases outside China, those that are suspected of having this virus should truly be isolated. They should be treated in a facility. They should be isolated in a health facility that's set up in that way. And that's really the way that you prevent spread. You make sure that these facilities that are set up to do that are operating properly. Of course, in China there are many more people, and there they are using the masks to make sure that those people that are symptomatic firstly distance themselves from other people, so it's what we call social distancing, and then use protective gear like masks and these hygienic practices that we've talked about. But for Kenya at the moment, the focus should be, if there are suspected cases, they need to be isolated in proper facilities.
Mm-hmm. All right, and let me ask you on the issue of where the challenge really is to get the cure for this virus, because it's even affecting trade relations globally, you know. So we also saw China did build an equipped hospital to deal with the coronavirus. Maybe you can tell us where you are in the research to getting, do we have any hope, especially for people affected? We have people dying daily. At what stage are you to establishing the treatment? You know, everybody's waiting to hear we found the cure for the coronavirus. Where are we? Is there any hope? Hope, especially for people affected. We have people dying daily. At what stage are you to establishing the treatment? You know, everybody's waiting to hear we found the cure for the coronavirus. Where are we? Is there any hope?
So at the moment, there is no treatment, as I mentioned before. WHO is convening the experts of this virus in the coming week to review all the clinical data. So, of course, those doctors and health workers that have been treating these cases have been trying out different modes of treatment. And this, of course, has to be reviewed to be sure what works. So currently, there are a lot of rumors, there's a lot of misinformation. People are saying this medication or that traditional medicine or that actually works, but that hasn't been reviewed. It has to be reviewed and scientifically checked. We must know that viruses are really difficult to treat, so that we have really few treatments for viruses. So for HIV, of course, we have things like antiretroviral treatment, but many of the other viruses are not treatable. It is really the body's immune system that overcomes the virus. So to ask when will we have the treatment is really difficult to answer. The other option, of course, is a vaccine. So vaccines take quite a long time to develop. Normally it takes years, 2-3 years to develop a vaccine. Even then it's quite quick. For Ebola, we have now been able to speed that up, and we were able to roll out a vaccine within a year. For this virus, it is possible that within 4 to 6 months we are able to trial a vaccine, but clearly that's quite a distance still away. So in this initial period, we should not pin our hopes on the vaccines, but really make sure that we contain the virus. That is the biggest issue at the moment, containment, following the contacts. So if you know who has tested positive, to follow the contacts of that case and make sure that they are regularly tested for fever and for symptoms, so that you can really contain it. So the current name of the game is really containment.
Yeah.
Treatment, unfortunately, will have to wait a while.
Yeah, and I'm still concerned about preventing or stopping the spread of this virus, because you're saying WHO has not restricted any travel restrictions or any evacuation of citizens. But at the same time, as our nations are worried that if we don't maybe cancel or stop flights to China, then we might have some suspected cases of people coming back with the virus. Do we have really a sure or the surest way of just interacting normally? Because there's also the issue of trade relations. Without spreading or without the spread of this virus, what is the ultimate goal or the surest way of saying, listen, you don't have to restrict yourselves from traveling to China. These are the kind of options that you have as we continue looking for the medication and treatment for the virus.
So the fact of the matter is, even if you would stop the direct flights, people, and also symptomatic people, are able to travel and do travel across the world. So while initially the link to China is very strong, of course that will weaken with time, and you might have a person from another country actually traveling and transmitting the disease. So it does not really make sense to say, by virtue of just stopping the direct flights to China, that will necessarily deal with the issue. And countries should really focus on the screening of patients. And here in Kenya, actually, they have done so. They've actually started screening not only those people that come directly from China, but really screening all the people that are entering the country. And that's exactly the right approach, because people can use other routes than the direct routes to come here.
Yeah.
So again, the focus is on containment, and the focus is not necessarily on travel restrictions, but really making sure that you keep a good eye on those people that are entering the countries. Should a country decide on travel restrictions, again, as I said before, that is the country's sovereign right to do so, and WHO recognizes that. The country should then just present its information to WHO with the reasoning.
Yeah, maybe because you mentioned there is no cure for this and treatment, you can let the world understand what are some of these things or unknown issues that you are struggling to understand about this virus.
Well, there are many things that we do not know about this virus. So it's a little bit more than a month into this virus. So, for instance, you mentioned the issue around the asymptomatic transmission. It seems very much so that asymptomatic transmission is not a common route of transmission, but that has to be investigated further. So that's what we need to make sure. The treatment issues you mentioned are equally important. So there may in fact be treatments that we have not tried out yet, but as we go deeper into the epidemic and have more experience, we find out how to do that.
Yeah. And there was also the issue of a report on unborn child, born, actually a child, an infant, found or diagnosed with coronavirus. Maybe you can also explain the possibility of transmitting, especially for pregnant and breastfeeding mothers, transmitting to the young ones.
Again, that's still under investigation. It's a single case that we know of. It is not clear if the virus transmitted in the womb, so that's what we call transplacental transmission, or if the virus transmitted during the birthing process. So that is not quite clear, and actually they have quite different consequences. We don't know if the virus transmits with breastfeeding, so that is not known at the moment.
All right. And as you are investigating all these unknown issues that you are talking about, maybe what are some of the challenges that you're facing in terms of resources? Are there enough resources to do all this?
WHO has just published a strategic plan for the prevention and response of this virus, and actually has outlined the resources that are needed. Most of those resources are actually targeted at those countries that either have weak systems or have overwhelming caseloads. So those are the two areas of focus. And in fact, in those areas, we have calculated on what is needed to support these countries and have made this available to the international community, requesting also that those resources are released not only to WHO, of course WHO also needs resources, but to those countries that are in need. It's quite a considerable amount, but if you think about it, the amounts that would incur if you don't do anything are so much more. So as the Director General has stated frequently, this is still the time where we can actually act in the preventative manner before it gets out of hand.
Yeah, maybe we can take a few questions before we close. Someone is asking about the signs and symptoms. I think you talked about that. But there's one concern: how safe is the isolation measure in preventive, of course, preventing the spread?
So the isolation is set up to actually prevent the transmission. The entire facility is set up in such a manner that transmission does not occur. It's purpose-built for that intent. While we have few cases, these facilities will be able to do that. If there are many cases, of course, one would need to open additional facilities, and of course, with many cases come additional problems.
Yeah.
But the design of the current isolation facilities available to Kenyans is such that it prevents the transmission. So in fact, what you want is that suspected cases are in these isolation facilities. That's the very best place for them to be. They can be treated properly without transmitting to others.
Yeah. All right, and someone else is asking, is Kenya ready to prevent, to handle this virus in case of any case in terms of the structures and the expertise here?
So we have been supporting the Kenyan Ministry of Health and have been working with them to actually get the country ready. It's a process of getting ready. The initial cases that have been detected, the suspected cases, have been handled quite correctly. So the procedures are actually in place. The way that they were handled were quite correct. They were taken into isolation through the proper mechanisms, with the proper vehicles, with the proper protective gear, and were then tested appropriately. So what we can see from the current situation is that Kenya has been able to meet this challenge at this point. It is difficult to predict the future. It's a bit difficult to say what would happen if there are many suspected cases, or if indeed there are many confirmed cases. So there surely are situations where health systems can be overwhelmed, but as it is at the moment, Kenya is quite able to deal with the importation and the looking for suspected cases.
Yeah. And how long will it take, because you mentioned South Africa as the center so far that we have in Africa for testing for this virus. So how long does it take before the results are out? Is it 1 day, 2 days during investigation of the suspected cases?
It normally takes between samples to be sent to South Africa and the results to be made available. But as I said, the capacity to actually test for this virus will be made available to Kenya hopefully within the next week or within the next 10 days, so that it's possible to actually do the testing right here. And that will speed up things dramatically, of course. You would be able to do the test within hours.
Mm-hmm. All right, Dr. Rudi Eggers, a representative, World Health Organization for Kenya, thank you so much for making time for us and, of course, answering a few questions and responding to a few concerns that Kenyans and the world had.
Thank you so much. It's been a pleasure.
Thank you so much. And thank you all for watching Family Matters tonight. Thank you for your feedback. Thank you for your questions. I hope now you understand what this coronavirus is all about, and as the World Health Organizations clearly indicate, that investigations into how it could be especially treated are still ongoing, and so far the only available ways of maybe preventing it is just using the normal preventive measures as highlighted by the World Health Organization. Thank you once again for your time. I'm Purity Musea, and Steve Dunde has been our sign language interpreter tonight. Do enjoy the rest of your evening, and God bless.